had a fall in January, and well, it wasn't a pleasant experience, that's for sure.
When something happens to your mum and you just want the best care for her, you know, I went into overdrive really, looking for what was available out there, and there is so much, but it's very difficult to find your way through the system, and Claire, the care coordinator, has been absolutely wonderful. It's made things a lot easier for me.
The main benefit for a patient is that there is one designated person who is responsible for their health and social care coordination, and that one individual would be aware of what their needs are and what steps have been taken towards making sure that those needs are met. The village meetings usually would be attended by somebody from environmental health, social services, GP, one of our district nurses, a community nurse, and lots of other people that are quite useful to have around the table when looking at patients' needs from a holistic point of view.
Village working is for any patient who's got complex health or social needs. In order to be discussed at one of these meetings, they need to be referred in. This can be done via the GPs, community matrons, district nurses. There's many different people who can refer in.
So our next patient is Aisha Demnati, and she's been referred to us because she needs OT and mobility assessment. She also informed me that Mr. Demnati is not sleeping well at night and she'd like a medication review to be done. So I just wondered whether, Karina, you could go in and do an assessment on her and just see how she's mobilising, make sure she's safe.
Sure. Following on from the village meeting, I'm here to see Mrs. Demnati. Can you tell me how your mum's doing today?
A little bit more confident than since you last saw her. It's nice to have people to turn to. It makes it that much easier. And you couldn't come in a better time because my mum's having a medication problem at the moment, and I was really sort of not knowing what to do because I'm not a doctor. She's my mum, I love her, and I will do anything I can. You love somebody, but if you haven't got the qualification and the right people to help you, you can't do it alone.
I think it's benefited all the people involved. From a patient point of view, I think it's made their life a little bit easier in terms of understanding the process of being referred from their GP practice onto any other professionals within, community or secondary care. I think from a GP point of view, it helped us save time in needing to process all these referrals, and so we get this extra time to spend with our patients, which is something that we've all wanted to do for a long time.
Claire's really helped us to understand the range of services out there, hasn't she? Dietitian, physio, audiology, podiatry. Those things are a bit more difficult to navigate through.
Very grateful. I really am deeply grateful for any assistance that I'm given.
I think quite often we forget that we're actually dealing with real people, and I think it's really nice to actually, take on a person's case and be able to see things through and actually see positive outcomes for individuals and make a difference to people's lives.